At SUNY Downstate, community engagement for us is a vehicle. It's a vehicle for us to achieve important aspects of our mission. It plays a significant role in the education of our students, in the recruitment of new students and diverse populations to SUNY Downstate, and community engagement also informs clinical practice. We listen to the voices of our community members. We look at community engagement not as a one-time event, but as a partnership. So we serve many communities. We have a very large Black and Afro-Caribbean community. We have a very large community that are immigrants. As a matter of fact, there are communities in around Flatbush that we often refer to as Little Haiti because of the diverse Caribbean influence in that community. I'm a Haitian immigrant, so being at SUNY Downstate and having the opportunity to work with multiculturally diverse and linguistically diverse communities is such an important aspect of my career. So I am so fortunate and blessed to be a part. Not only do I work in Brooklyn, but I'm also part of the community, and I believe that I am of the community. Our students become involved in community engagement from the first day. Before they start medical school, they learn about community engagement opportunities.
Here in Central Brooklyn, we serve an underserved population, and so it's really important for us to connect with them, with the services here that the medical center does provide. The pandemic happened since 2020, and during that time, a lot of people lost touch with healthcare providers. So by coming to an event like this and engaging with the community, it gives an opportunity to check on them. Here we're checking people's blood pressure. High blood pressure or hypertension is a very common medical condition. So if it's something that we can identify for patients, that's one step towards motivating them to get connected with healthcare providers.
It's very important that we screen for blood pressure and BMI, just so patients are aware of their risk for any future heart disease or diabetes. Also for any patients that lack health insurance in this population, we're also giving them forms that can help sign them up for free colon cancer and breast cancer screening.
We have a program at SUNY Downstate known as BK Swag. And BK Swag stands for Brooklyn Scholars with Athletic Goals. And this is a partnership with local high schools such as Erasmus Hall, where we work with the coach, the parents, and the students who are interested in health, but also our athletes.
We also recruit a lot of the students from medical students, nursing schools, the PA students that would very much like to have the experience in meeting the members of the community and also train with us in providing basic health screenings and basic health education, such as preventative cardiovascular diseases, cancer prevention. And we find that the students are very satisfied in at least coming out to the community, meet with the community, see where the health disparities are, and bring satisfaction for the community and for themselves to learn about community engagement. When we first started our community outreach program, there was a tremendous amount of mistrust because they didn't have very good experiences. The community feel that we are a research hospital. So by going out into the community and educating the community, this is how we build trust over time.
We want our students from Downstate to represent the community. So by working with community schools and high schools and starting early, really early in the program, we have an opportunity to recruit the most talented students from Downstate who are from the community, who live in the community, and who want to give back to the community.